Hi friends, Dr. Arun Dhir here, and in this video I'm going to be answering this one question that comes up so often, that how safe is weight loss surgery? And to put it a little bit more dramatically, the question that I get asked sometimes is, will I die having my surgery? Well, let's look at it very objectively. There are two aspects to weight loss surgery. One is the risk of surgery versus the risk of remaining where you are, which is risk of obesity as such. And then the second aspect that we will discuss in this video is the safety profile, which is where we talk about the risk of dying and other complications of different weight loss operations that are considered fairly standard. So let's put things into perspective. Obesity is now regarded as the second leading cause of premature death. Premature death is defined by death under the age of 75 years, and the first cause being that of heart disease. See friends, obesity itself, or specifically morbid obesity, when the BMI goes above 35, is considered to be the same risk that an individual who's been smoking for 15 years and smoking 15 cigarettes a day has got. And for each BMI point that goes above 35, your risk in comparison to smoking years also gets increased by an year. So there are lots of known conditions which are associated with obesity which increase an individual's risk of death anyways. For example, diabetes. Diabetes is something that we know affects everything from head to the toe. Ischemic heart disease or heart attacks, and cancer, specifically prostate cancer and colon cancer in men and women, colon cancer of course, but breast and uterine cancer in women are associated with obese status. So treatment of obesity with either weight loss surgery or other modalities, whether it's medical or lifestyle changes, whatever it is associated with not only increase in lifespan but also in the quality of life. Studies have proven that cancer mortality, which is death because of cancers, is reduced by 60% after weight loss surgery. Death because of diabetes is reduced by about 90%, and death because of heart disease is reduced by about 50%. So there are significant benefits, and when we talk about benefits of weight loss, and we know that when the BMI goes above 35, surgery remains a powerful, effective, and a durable tool to achieve lasting weight loss success. Now let us have a look at the risk of surgery itself. See, there are three aspects that decide about the risk of developing complications or death as far as surgery goes. The first is the type of surgery that is being considered, such as if we use a spectrum, and a spectrum means from the safest operation, and mind you, safest operations are not necessarily the most effective operations. So we have to make sure that we make that distinction very clear. So the safest operation is that of the lap band, because it does not involve any cutting or dividing of the stomach. Lap band is basically just a ring that is being placed, which is considered one of the safest operations. And then as we progress further onto slightly more riskier procedures, we go from lap band to the sleeve, which has got a slightly higher risk profile than that of the lap band. Then we go to the mini gastric bypasses, then to the single anastomosis gastric bypasses such as the SADIs, and then we go to the Roux-en-Y gastric bypass, which is the double joint gastric bypasses. So as we increase the complexity of the procedure, and if we go to revisional surgery, which means conversion of lap bands into a Roux-en-Y gastric bypass or any other procedure, the risk of the surgery itself increases. So that is the type of surgery. The second thing is that of the patient profile. So if an individual has already got diabetes, renal failure, sleep apnea, or is an older person, such as above 75 years of age, their risk of developing complications is higher because the body's reserve is less. And the last and the most important factor that determines the risk of surgery is the experience of the surgical team. See, it has been studied that high volume surgical centers, which in Australian settings are centers that are doing at least more than 250 bariatric operations in a year, have developed enough technique. And it's not just the surgical technique, or it's not just the surgeon, but it's the whole team. It is the nursing staff in the wards and the ICU care and things like that. In fact, a very good resource to look at about the risks of associated with the high volume sort of centers of bariatric surgery, a good resource is the Bariatric Surgery Registry, which is a very robust platform into which various centers are putting their data, and it is not necessarily biased. But in summarizing, what I do want to say is that there is a very good study that is called the LABS study, Longitudinal Assessment of Bariatric Surgery study, and they found that the mortality or the risk of death associated with weight loss surgery is to the tune of 0.3%. To put things into perspective, that is very comparable to the risk of someone having keyhole surgery for removal of the gallbladder, which is called laparoscopic cholecystectomy. Some of the key risks or complications of weight loss surgery basically stem from these three conditions. Number one is the risk of bleeding, which, as you know, is common to any operation. Number two is the risk of sepsis or infection, and that infection generally comes from a leakage, which is more sort of associated not so much with the lab band, but more with procedures like the gastric sleeves and the gastric bypasses. So I hope you found this video useful. If you did, do subscribe to my channel and share this video, and remain in touch for forthcoming videos. Thank you.